Nearly a year ago, Justin Richards suffered an injury that took him off his job and his feet.
I was working and I ended up tripping over a string line, hyperextended everything and tore ligaments and broke some bones inside of the foot.
He came to see Dr. Nicholas Wischmeier, a CHI Health orthopedic surgeon who specializes in foot and ankle surgery. In addition to damaging ligaments and tendons in his foot, imaging revealed Justin also had an accessory navicular, meaning he was born with an extra bone in the arch of his foot, a condition that affects about 14% of people.
Most people live with this their entire life and never have an issue, but if an injury is sustained in the area, it can either cause tendon tear, occult fracture of the navicular bone, or irritation of that pseudo joint. He basically had a very painful, inflammatory joint that a tendon was pulling on every time we stepped because it's one of the most important tendons in our feet.
Dr. Wischmeier operated on Justin's foot to repair the bone and tears, which meant weeks without walking and then physical therapy.
I was frustrated really bad at the beginning because I couldn't balance on one foot. And that was probably my biggest wake up of you got to get your stuff done and make sure this is right. I was really motivated to go goose hunting. So that was my big motivation. And then softball for my daughter was a big motivation to be able to keep up with her and help her practice and do what she needed to.
From balance exercises, box sits, and cycling, the CHI Health rehabilitation team helped Justin get back on his feet, back to work, and doing what he loves.
His motivation in rehab and his desire to return to work, I felt really set him apart. And I thought his recovery went quicker even than I would have expected it to based upon those things. And I think it really shows that the appropriate motivation and appropriate desire to work, return to activity following a procedure are essential to get the result you want.
Justin says he'll never take walking for granted again. From surgery to PT, he credits CHI Health for his comeback.
My therapist was awesome of, hey, this is stuff you can work on at home. This is where I would like to see you. And she was really understanding that I was going to push myself to meet those goals faster.